All right, welcome back, guys, to our Fit Tips. We are still here with our expert, Dr. Hiza. And today we want to talk about women that are postpartum. We had a question come in asking how to get back to having a flat tummy after you've had a baby. And so, since we have him, we're keeping him for all of the questions, so he can be the brains of this operation. What do you recommend that women that have just had a baby, that are obviously cleared to do these, start incorporating into their exercises to get their abdominal muscles back to as close to normal as they can?
Thanks for having me again. I appreciate it. I think the biggest challenge postpartum is thinking that you can just exercise as hard as you did before pregnancy. In the beginning, you want to take it easy and kind of let your body adjust. There are a lot of hormones that are released during and after pregnancy that need to kind of level off. And some of these hormones lengthen soft tissue or thin out certain muscles and certain connective tissue, especially your abdominal muscles, to allow the belly to expand. So you want to take it easy in the beginning in general, but more importantly, when it comes to strengthening the abdominal muscles again, you can actually do a much more effective program that will actually strengthen your abdominal muscles, maybe even stronger than before you got pregnant. So, but the most important thing in the beginning is to just get a lot of cardiovascular exercises, a lot of walking. Walking is a great one to kind of get your body moving, get the abdominal muscles and low back muscles working together again while those hormones are leveling off. And then certainly, beginning abdominal exercises, especially, if you had a C-section, you may want to consult with your OB as far as when you can return to those exercises or when you can return to more intense abdominal exercises. But it doesn't always have to be 6 weeks. Sometimes it can be earlier, especially some of these movements that naturally recruit these muscles whether we like it or not. So that's what we're going to review today. So the first exercise that I normally will instruct my patients postpartum on how to get those abdominal muscles and low back muscles going again is just doing a prisoner squat hip hike. What I like about this exercise is that it starts to re-educate the body on weight shifting. So I've got to shift my weight a little bit to lift that leg. So in the process, I'm actually recruiting all these muscles. It won't be as intense as doing a crunch. It won't be as intense as doing a plank. But you need to remember this is early, so we want to gradually build up that fitness. We want to gradually build up that capacity. So another version, it's the same idea. So once you're here, instead of lifting your arms up here, you're going to do extensions. So you're going to sit here, lift. So again, a great way to get hip flexor strength back, a great way to get the back of the shoulder strong, but also a great way to recruit all these muscles simultaneously. It'll get your rectus abdominis. Those are the ones that really stretch, and then you'll get your obliques going at the same time. The other alternative is I'm going to have Lauren demonstrate, so you can do the same thing and just use postpartum client here, and you can use the band. So just step on this guy right here, and then just crisscross, and then you're going to do the same thing. So just up and out. So back and forth. So it's a great way to get all those muscles recruited. Now you have the little instability with the ball, and then you've also got the shoulder muscles working a little harder with the tension on the band. So that's how I would get those two muscle groups going and get.
Did she also do the marches on the ball?
I was just going to ask
you
that.
can do the marches on the ball. That's a
Would that be
great
like the
one.
next step up?
That is the next step up. It is a little bit more strenuous. Yeah, it is a little bit more strenuous.
It's kind of difficult, guys.
But
Even
it
if you're
will,
not postnatal.
yeah, it will teach you how to weight shift. So one of the things I will do is that when you start noticing it's a little bit more challenging, just turn your toes out. There you go, and then bring your knees out a little bit. There you go. So now it's shifting your weight over, so you won't get as much of a lift, but you'll really feel a lot more of those muscles doing all the work.
She has all of the tricks.
All of them.
So that's a great way to do that. Now again, you'll see that when she lifts one side, she immediately brings it back down. That's kind of what we see as weaknesses or insufficiencies. And those are the areas that you want to keep targeting to make sure that once you can do this without the body doing that quick drop, then you can start to begin the more aggressive strength and conditioning exercises for your abdominal muscles.
Now, one more question to kind of follow up on what you just said. So let's say someone's just started, like they're 6 to 8 weeks out, or whenever their doctors have cleared them to start their workouts, and they're starting to incorporate some of these. Would you say it's also okay for them to start doing lightweight loaded exercises, or do you think things like this should be mastered first before they start incorporating external loads?
That is a great question. I would say that it depends on your past history. If you are comfortable exercising, or if you were comfortable exercising regularly with, lifting before you got pregnant, it's perfectly okay to start that process postpartum with lighter resistance than you're used to, and just kind of gradually build up. If you've never exercised with weights, if you've never pushed it that aggressively, you probably want to just work on stabilization exercises first, build that fitness capacity, then start to incorporate lighter resistance first. I wouldn't go right into strength and conditioning with external loads like dumbbells or kettlebells too soon, because if you're not used to it, there are a whole lot of other factors that are going to be played, not just the postpartum adjustments. A lot of it is really just getting used to that weight too. But most people who are used to exercising regularly though, they're pretty comfortable with that weight. They know what that feels like. They know what good stress and bad stress feels like. Novice are not going to know that. It's going to be a little harder for them to appreciate that. So that's why this is better.
One last question to pick your brain again. Anything that you would say should be like avoided for people that are postpartum, that are again just cleared to work out and are just starting and haven't worked on these things, or are just starting to work on these?
Yes, great question. I think, avoiding exercises sometimes sounds like a scary thing, but the goal is really to avoid a lot of these secondary complications that could occur postpartum. One condition is developing diastasis recti, which is a separation of the rectus abdominis muscle. So those are the two abdominal muscles that run on either side. In the middle, they share this connective tissue. What can happen is if you do a lot of crunches early, if you're doing a lot of planks early, or if you're doing any exercise that compresses and creates a lot of intra-abdominal pressure, that can cause a lot more separation there than necessary. It's not unusual. About 30% of pregnancies will incur some diastasis recti, but it usually resolves on its own. But if you get really aggressive in the beginning with heavy reps or high reps of crunches and planks, that can actually complicate that condition and make it worse. And sometimes it can be irreparably, you can irreparably change that length and create some other conditions like a hernia. Okay. So what I usually will tell my patients postpartum is avoid getting straight up like this. You'll want to log roll and get up. That puts the least amount of stress on the abdominal contents. The other thing is finding compound exercises like we talked about earlier that recruit all those muscles simultaneously without increasing that pressure. So if you have to hold your breath and do that, you're going to be creating more intra-abdominal pressure. Heavy lifts will create intra-abdominal pressure because you're going to hold your breath.
Yeah.
Right? So we want to work on trying to avoiding that at all costs. In part because it just will complicate things. It will complicate a lot of your healing as well.
So until that's healed and recovered,
until that's healed,
you're more stable. Avoid those, but later on,
it's, you should be able to resume pretty much everything that you want to get back to do. But again, those may not even be the most important exercises anyway, as far as getting your core strength back. I would say, squats and deadlifts and lunges. Those are a lot more effective as far as targeting the entire body and really kind of getting you back to that, hey, I'm ready to get back to my strength and conditioning program. Planks and abdominal crunches, they're great, but they're not necessarily specific to kind of what we do day to day. We want to do things that are, because again, you've got a kiddo now, so you're going to be picking that baby up all the time. You're not going to be, will not have time for that. There is no time. That's over. So you will have to find, new ways to kind of get around that.
All right. Awesome. Thank you so much.
You're welcome. You're welcome. And thanks for having me. Appreciate it.
Thank you. Hope you guys enjoyed our tips. Let us know if you have any questions, and we'll be back soon.